So there are various gait deviations that can occur with a transtibial amputation. So with the prosthetic. So the first one I want to go over is when they're having a excessive knee flexion during their stance phase. So when they're putting weight on their prosthetic side, it's like buckling. So this can be caused by a flexion contracture at the knee. So that would be addressed by stretching during therapy session, trying to stretch out that contracture, or it could be due to the weak quads. So if they're unable to bear that weight and activate their quads properly, it's going to make them buckle when they're in stance phase. This also can be caused when the foot of the prosthetic is in too much dorsiflexion. So they're translating too much over, and it doesn't give them the ability to straighten their knee. So they're having excessive flexion. Or they could have a heel that's real stiff, hasn't been broken in with, or the foot of the prosthetic could be placed too posteriorly, which would make the foot be more dorsiflexion, or the socket could be placed too anteriorly. And then another one is when they don't have enough flexion during their gait, so they're walking with a straight leg. So this can be caused also by weak quads, because people with weak quads tend to throw that leg to lock it out extension when they're walking if they don't have strong quads. Another thing is they're using their quads too much. They're scared. They don't know how to walk on it yet, so they're just stiff. They want that leg locked so they know it's secure. So they're not letting it bend themselves. From the prosthetic standpoint, it can be the opposite of the excessive. So the foot of the prosthesis could be too anterior, where the socket is too posterior, making them have a straight leg. Another thing is if that foot on that prosthesis is in too much plantar flexion. So just like any other patient with high tone that's stuck in plantar flexion, how they can't swing their foot all the way through, so they're just gonna keep that leg straight. Let's see. So then we're gonna go into the valgus and varus. So if patient is having valgus on their prosthesis side where their knee's going in, it could be because their basis of support is they're walking too wide. So it's putting more pressure on that lateral side of that knee, making it go into valgus, or an abduction contracture. So they're not able to make their base of support smaller. Another thing could be that, so this also goes back to the setting. So if the foot of the prosthesis is put too far out and the socket in, that's going to create that also. And then another thing is if the prosthesis itself is too long. Once again, almost like the patients that has any kind of tone, they're having to kind of swing that out, and then that's going to make their base of support wider, which is going to cause that valgus. And then another one is going into varus, so it's pretty much the opposite. It could be from walking with a too narrow base of support, putting more pressure on the medial side, pushing out, or prosthetic can be too short, or there can be an adduction contracture as well. So stretching those are really good, and strengthening those muscles that are weak. Let's see, sometimes there can be some excessive toeing in or toeing out. You can see it almost like whipping when the patient walks on their prosthesis. This is mostly just because the prosthetic isn't lined up properly. It may be a little twisted, so it may look fine when it's on the ground, but then you pick it up, you see it toeing. So making sure that prosthetic is put on properly and worn. And then there's the pistoning. So that's just when the prosthesis is not fitting, so they're just kind of sliding up and down. Maybe they need some more socks, maybe the socket's too big, just the fluctuation of the edema and the swelling in that limb. So making sure that your patient is doing correct sock management and taking care, looking for those red spots, because they're going to have one if they're just pistoning in and out of their prosthesis. But I think that's all of them.